Did you know that up to 5% of the population suffers from carpal tunnel syndrome? A staggering figure, isn't it? This unseen epidemic is more common than you might think, silently affecting millions of lives around the globe. Let's paint a picture. Meet Jane. She's a talented graphic designer, her hands constantly dancing over her digital tablet and keyboard, creating stunning visuals for her clients. Recently, though, she's been experiencing some peculiar symptoms in her hands. They start with a tingling sensation in her fingers, especially in her thumb, index, and middle fingers. She brushes it off as a simple sign of fatigue, but the tingling soon turns into a persistent numbness that's hard to ignore. Over time, Jane starts to notice a growing weakness in her hands. Simple tasks like lifting her coffee cup or gripping her stylus become increasingly difficult. The discomfort escalates, disturbing her sleep with sharp pain coursing through her hand, wrist, and arm. It's more than just a hindrance. It's starting to affect her work, her daily life, her peace of mind. She's not alone in this. Millions like Jane are grappling with these symptoms in silence, unaware of the underlying cause. This discomfort, this pain, this weakness, they're not just signs of overwork or simple fatigue. They're signals from our body, a cry for help that something is not quite right. Jane's story is not unique, but it's one that often goes untold. It's a testament to an issue that, while common, is frequently underestimated and overlooked. It's the narrative of the unseen epidemic of carpal tunnel syndrome, a condition that's more prevalent than we realize, and one that can significantly impact our quality of life. So what could be causing these symptoms? Why is Jane, a seemingly healthy individual, experiencing such discomfort? Well, the answer lies in the intricate anatomy of our hands and the way we use them. Let's dive into the world of carpal tunnel syndrome, unravel its mysteries, and learn how we can address it. Imagine a tunnel, but this one is in your wrist, and it's called the carpal tunnel. This tiny yet significant passage is a hub of activity, housing the median nerve and several tendons that allow your fingers to flex. It's a marvel of human anatomy, but when something goes awry, the results can be truly bothersome. Now, picture Jane. She's a graphic designer, and she spends hours manipulating her stylus and keyboard. Over time, she started feeling a nagging pain in her wrist, which she dismissed as a minor strain. But the discomfort persisted, and soon enough her fingers began to tingle and her grip strength faltered. Jane's discomfort is not just a minor inconvenience, it's a sign of something more serious: carpal tunnel syndrome. This occurs when the carpal tunnel, that small passage in the wrist, narrows. This narrowing compresses the median nerve, which controls sensation and movement in the thumb and first three fingers. But what causes this narrowing? It's typically due to swelling and inflammation of the tendons in the wrist. This can be triggered by repetitive hand use or maintaining the hand in the same position for extended periods, like Jane's hours spent at her drawing board. Certain medical conditions like diabetes or rheumatoid arthritis can also increase the risk. The effect is akin to a river being dammed. The nerve impulses get blocked, leading to symptoms like pain, numbness, and weakness in the hand. It's a ripple effect that starts in the wrist and extends to the hand and fingers, impacting daily activities and quality of life. As Jane's case shows, carpal tunnel syndrome is a hidden culprit, often overlooked until it becomes a persistent problem. It's a silent epidemic, taking hold in the lives of countless people like Jane, who rely on their hands for their livelihood and daily activities. Now that we know what carpal tunnel syndrome is, how can we recognize it? Stay tuned as we delve deeper into the symptoms of this common yet often underestimated condition in the next scene. Jane started noticing her symptoms a few months ago, but what are these symptoms exactly? Well, like many who suffer from carpal tunnel syndrome, Jane's first encounter was a subtle discomfort in her hand. She'd wake up in the middle of the night, her hand numb and tingling. It was as if her hand had fallen asleep, but unlike a typical sleeping hand, shaking it off didn't bring immediate relief. This numbness and tingling, especially during the night, is one of the key symptoms of carpal tunnel syndrome. As days turned into weeks, Jane noticed that her hand strength seemed to be dwindling. She struggled to hold her morning coffee mug, a task that used to be second nature. This weakening of hand strength, particularly when trying to grip or lift objects, is another telltale sign of carpal tunnel syndrome. And then came the tingling. It was a constant sensation, like pins and needles pricking her fingers, particularly in her thumb, index, and middle fingers. The tingling was more than just an annoyance. It was a constant reminder that something wasn't right. Jane also noticed a growing difficulty in holding small objects or doing precise tasks like buttoning her shirt or picking up coins. She would often drop things without any warning, as if her hand had a mind of its own. This unexpected clumsiness and difficulty in gripping is another symptom of carpal tunnel syndrome. All these experiences of Jane are classic symptoms of carpal tunnel syndrome. It's a condition that creeps up on you, starting subtly, almost imperceptibly, then gradually making its presence known with increasing discomfort and inconvenience. So Jane recognizes these symptoms in herself, but what caused her to develop carpal tunnel syndrome? Well, that's a question we'll tackle in the next segment, because understanding the causes is just as important as recognizing the symptoms. It allows us to make informed decisions about our lifestyle and habits, helping us to prevent or manage this condition. But for now, let's take a moment to appreciate Jane's journey in recognizing her symptoms, a crucial first step in addressing carpal tunnel syndrome. Carpal tunnel syndrome doesn't just appear out of nowhere. There are specific causes behind it. The roots of this condition often lie in our day-to-day activities, many of which we might not even consider harmful. Let's take a look at Jane. She's a hard-working writer, spending long hours typing away on her keyboard. This constant, repetitive use of her hands puts her at risk for developing carpal tunnel syndrome. And it's not just typing. Any activity that involves the frequent and continuous use of the hand and wrist can contribute to the syndrome. Craftsmen, assembly line workers, and musicians are just a few examples of those who might find themselves falling into this category. But it's not only about the activities we do, it's also about how we do them. Jane often finds herself typing away in a hunched position, with her wrists bent at awkward angles. This incorrect hand and wrist position, maintained for prolonged periods, can increase the risk of carpal tunnel syndrome. Now, let's delve a bit into Jane's medical history. She has been living with diabetes for several years. Certain medical conditions like diabetes or rheumatoid arthritis can make individuals more susceptible to developing carpal tunnel syndrome. These diseases may cause inflammation in the body, which can lead to a narrowing of the carpal tunnel and subsequent compression of the nerve within it. And lastly, it's worth noting that hormonal changes and genetic factors can also play a role. Women, for instance, are 3 times more likely than men to develop carpal tunnel syndrome, possibly due to the smaller size of their carpal tunnel. So we see a picture emerging here. Carpal tunnel syndrome is a product of a combination of factors: our lifestyle choices, our work habits, our underlying health conditions, and even our genetic makeup. Now that we've identified the causes, how can Jane and others like her find relief? Let's explore this in the next segment as we delve into the solutions and treatments available for carpal tunnel syndrome. No one wants to live with constant pain and discomfort, so how can we treat carpal tunnel syndrome? As with many health conditions, the answer lies in a combination of lifestyle changes and medical treatments. Let's start with the simplest solution: rest and activity changes. Reducing the excessive use of the hand, particularly in repetitive activities, can alleviate symptoms. It's about finding that balance, learning to recognize when your body is saying enough is enough, and giving yourself permission to pause. Physical therapy can also be a powerful tool in the fight against carpal tunnel syndrome. Targeted exercises can help strengthen the muscles around the carpal tunnel, improving flexibility and reducing pressure on the nerves. Think of it as a workout routine for your wrist, designed to build resilience and restore function. Next, let's talk about ergonomic wrist supports. These are tools and accessories that support the natural posture of your hand and wrist, reducing pressure on the carpal tunnel. They come in many shapes and sizes, from specially designed keyboards to wrist braces, and can be particularly beneficial for those who spend long hours typing or performing repetitive hand movements. In some cases, anti-inflammatory medications may be prescribed by a healthcare professional to reduce inflammation and pain. These medications work by reducing the swelling in the carpal tunnel, providing temporary relief from symptoms. Finally, in severe cases where other treatments have not been effective, surgery may be considered. This procedure involves making more room in the carpal tunnel to relieve the pressure on the nerves. It's a more invasive solution, but for some, it can bring significant, long-lasting relief. So there you have it. From rest and activity changes, physical therapy and ergonomic aids, to medication and surgery, there's a wide range of solutions available to help manage carpal tunnel syndrome. It's about finding the right combination that works for you under the guidance of a healthcare professional. With these solutions, Jane can start her journey towards a pain-free life. But what can we learn from her story? Let's explore that in the next segment. Carpal tunnel syndrome is more common than you might think, and it can significantly affect your life. As we've journeyed through this discussion today, it's clear that this condition is not to be taken lightly. The implications on our daily activities, our work, and overall quality of life can be profound. We've uncovered the identity of this silent culprit, the carpal tunnel, a seemingly insignificant structure in our wrist that plays a crucial role in the sensitivity and movement of our hands. When this tunnel becomes too narrow, it gives rise to the discomforting and often debilitating condition we've come to know as carpal tunnel syndrome. From the telltale symptoms of pain and numbness in the hand, wrist, and arm, to the more subtle signs like a tingling sensation in the fingers and difficulty gripping, recognizing these early on could be the first step in addressing the issue. Remember, the hand's strength may decrease, and holding small objects or grasping with precision may become increasingly challenging. The causes of carpal tunnel syndrome are varied, but repetitive activities, incorrect hand position, and certain medical conditions can all contribute. It's a reminder of the importance of taking breaks, maintaining correct posture, and managing underlying health conditions effectively. When it comes to treatments and solutions, there's a spectrum of options, from changes in daily activities and rest to physical therapy, ergonomic wrist supports, and anti-inflammatory medications. For severe cases, surgery may be an option. The key is to consult a healthcare professional for a thorough evaluation and personalized treatment plan. In conclusion, carpal tunnel syndrome is a common issue that can significantly impact the quality of life. Recognizing early symptoms and adopting preventive measures can make a difference. If you experience persistent symptoms, it's always advisable to consult a healthcare professional for a more in-depth evaluation. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more health-related content. Your health matters, so let's keep the conversation going.